imagine you're at a peaceful meditation retreat. Everything's calm. And then suddenly someone starts behaving in a way that's completely unexpected, maybe even, alarming. They might be talking nonsense, gesturing wildly, maybe even throwing things. What's actually going on there? Is it like a spiritual disturbance? Something medical?
Or maybe something else entirely.
Exactly. Something we just don't understand at first glance.
That's a really powerful and honestly quite perplexing scenario, isn't it? Today, we're doing a deep dive into exactly those kinds of questions.
Okay.
And we're guided by the insights of Dr. Phang Cheng Kar. He's a consultant psychiatrist, a real expert in mindfulness, and also the president of the Kuala Lumpur Buddhist Mental Health Association.
Wow. Okay. So he's really well positioned for this.
Absolutely. Our goal here is to sort of navigate that complex intersection, mental health, spiritual beliefs, and these really unusual, sometimes bewildering behaviors. And while Dr. Phang's work is deeply rooted in the Buddhist community in Malaysia, the wisdom he shares, it's relevant for pretty much anyone curious about these complex human experiences.
And that's really our mission with this deep dive today, isn't it? To help you, our listener, understand the crucial differences and maybe the surprising overlaps between what could be psychosis, a genuine spiritual experience, or maybe, a mix of factors. We're drawing right from Dr. Phang's expertise, his real-world cases.
Yeah, the actual case.
Aiming to give you those aha moments so you feel informed, but hopefully not overwhelmed. So let's get into it.
Sounds good.
Dr. Phang has this really brilliant way he starts talking about this. He begins with real local cases he's seen. Unusual behavior within the Buddhist community.
Right.
And it immediately gets his audience in, well, now you're thinking, like, you're a detective, a spiritual and medical detective.
It's a great approach. It really pushes us beyond those first assumptions, And yeah, these aren't just made-up examples. They're actual Malaysian cases he's dealt with. So let's maybe walk through 3 of them.
Okay, yeah.
And as you listen, I really encourage you to think, what do you suspect might be happening here?
All right, I'm ready. Case 1.
Okay, first case. The lady at a John Brahms retreat. This is a 26-year-old Chinese lady. She's attending a Dharma talk at the Subang Jaya Buddhist Association, SJBA. Not actually on the retreat, but present.
Got it.
And she's observed behaving very strangely, talking nonsense, wild gestures even, dancing in the temple.
Wow. Okay, so right away, what are the possibilities floating around?
Exactly. Dr. Phang puts it out there. Is it spirits? Black magic, maybe? A medical issue? Could it be a mix? Or maybe just seeking attention or even faking? What's your first instinct?
It definitely gets you thinking, doesn't it?
Yeah.
Especially in that setting, your mind kind of jumps to the spiritual side first, maybe.
It often does. Okay. Then there's the Taiwanese nun. She's 35, very educated, master's in biology, doing humanitarian work in KL.
Okay, impressive background.
Very. But she became extremely restless, pacing all the time, couldn't sleep. And then it escalated. She became verbally abusive, started throwing things.
Oh, wow. Quite a shift.
A huge shift. So again, Dr. Phang asks, could this be stress, possession, a spiritual disturbance, something from a past life, maybe severe anxiety, or even confusion about monastic rules, the precepts?
1,000.
Yeah.
Yeah, really unsettling, especially given who she is. It shows how many theories can seem plausible initially.
Exactly. And the third one, the staunch meditator. This is a 47-year-old Chinese lady, a really strong, regular meditator.
Yeah.
Goes on retreats every year.
Okay.
During one retreat, she starts to feel, subtly, that her meditation teacher can read her mind.
Okay. That's specific.
Right. But after the retreat, back home, it gets much more dramatic. She starts hearing distinct voices.
Voices? Like whispers or?
No, clear voices. And specific ones. Ajahn Brahm, Bhante Akachita, even her own deceased sister.
Whoa.
And some voices were good, giving advice. Others were bad, threatening her, demanding money.
That sounds terrifying.
It does.
Yeah.
She also felt scary, abnormal sensations in her private parts and heart area. And she believed her meditation teacher was controlling these sensations.
Oh, my goodness.
She even tried to test the voices, ask them for her dead sister's bank account number, something nobody could know.
Wow. So what are the theories there? Just crazy. Menopause, spiritual crisis, or, maybe Mara, the Buddhist tempter figure.
All possibilities people might consider. Right.
Yeah, these stories really show how complex things can get and how easy it is to default to assumptions when something's, unknown.
And like Dr. Phang says, these aren't rare, isolated things. They happen more often than we might think in communities.
So to really understand, Dr. Phang says we need to look at the medical side.
Yeah.
Specifically, psychosis.
Exactly. He emphasizes that psychosis isn't one single disease. It's a syndrome. Think of it like a collection of weird, odd, abnormal signs and symptoms.
Okay, a collection, not just one thing.
Right. And it indicates a pretty significant break from reality for the person experiencing it.
So what does that look like? What are the signs?
Well, the hallmarks can show up in different ways. One big category is hallucinations. That's sensing things that aren't actually there.
Like seeing things.
Seeing things, yeah, visual hallucinations. Maybe someone sees worms in their food. Or like the artist Louis Wayne, his paintings of cats got increasingly bizarre, kind of demonic as his schizophrenia progressed.
Oh.
Or hearing things, auditory hallucinations, like clear voices, just like the Meditator in Case 3 heard.
Right. She heard distinct voices.
Exactly. And there are even tactile hallucinations, feeling things that aren't there, like bugs crawling under the skin. Dr. Phang mentioned this is sadly common with abuse of shabu-shabu.
Shabu-shabu.
Yeah, it's a local term for crystal meth. It's notorious for causing really intense physical hallucinations.
Wow. Okay, so it's not just seeing or hearing things. This really changes how we might think about these conditions. It's not always the dramatic movie version.
Not at all. It can be subtle, but incredibly disorienting for the person.
What else falls under psychosis?
Well, besides hallucinations, a key feature is delusions. These are fixed, false beliefs. Really strong ones that don't change even with proof against them.
Like fixed ideas.
Exactly. Like the mind's built its own reality. There are different kinds. One is a delusion of control, feeling like your body or thoughts are being controlled by some outside force.
Is that like sleep paralysis?
It's different because this happens when you're awake. Dr. Phang told a really disturbing story about a man who felt controlled. Turned out he had a thyroid problem, undiagnosed.
Oh, no.
Yeah, and a traditional healer thought it was possession and burned him badly with joss sticks.
That's horrific. Shows the danger of misdiagnosis.
Absolutely. Then you have religious delusions, believing you're a god or Buddha or a specific venerable. Dr. Phang sees this quite a bit.
Okay.
And paranoid delusions, believing people are out to harm you. Think of the movie Black Swan, that kind of intense paranoia.
Right, okay.
Maybe one of the strangest is the delusion of reference. Thinking unrelated things, the radio, TV, colleagues chatting, are actually secret messages just for you.
Wow, that sounds incredibly confusing.
Extremely. Like a patient who thought a new icon on her computer was spying on her private life. And finally, there's disorganized speech and behavior. Talking nonsense, weird staring, maybe mimicking animals, making odd sounds.
It's just amazing how varied these experiences can be.
Yeah.
And how much they distort reality. But what actually causes psychosis? It sounds like it's more than just, traditional mental illness.
You're right to ask that. Dr. Phang really stresses it's fundamentally a brain condition, some kind of physical or biochemical issue.
Okay. So physical causes.
Yes, and the causes are incredibly diverse. It can come from psychiatric conditions like schizophrenia, A Beautiful Mind is a famous portrayal, or severe depression, bipolar disorder.
The ones we typically think of.
But, and this is crucial, it can also be caused by medical conditions. Things like epilepsy, heavy alcohol, or substance abuse, thyroid problems.
Thyroid, like that poor man who got burned.
Exactly, or even severe strokes, bad infections, liver problems. And Dr. Phang shared that very personal story about his own father.
Oh yeah, you mentioned that. What happened?
His father started acting really strangely at night. Restless, talking nonsense, making funny noises. Very alarming.
I can imagine.
It turned out to be dangerously low blood sugar. Hypoglycemia. Once they fixed that, the symptoms went away.
Wow. Just low sugar caused all that.
Yeah. It's a powerful reminder that many non-psychiatric medical problems can trigger psychosis.
That personal story really hits home. It makes you think how many cases might be missed without careful medical checks.
Okay, so let's unpack this. Remember those 3 cases. The lady at the retreat, the nun, the meditator.
Time for the reveal.
Yeah, what were the actual diagnoses?
Okay, so the diagnoses are really enlightening. Case 1, the lady at Ajahn Brahm's retreat showing strange behavior.
Yes.
Diagnosed with schizophrenia. It was her first contact with psychiatry.
Yeah.
And they found out her mother also had it, suggesting a genetic link. She started treatment and got better.
Okay. Schizophrenia. What about the nun? Case 2, the Taiwanese nun who became restless and abusive, also schizophrenia. But here's the thing. She'd been diagnosed before, back in Taiwan.
Oh, so it wasn't new.
No. And her relapse in Malaysia wasn't stress or breaking precepts. It was simply because she'd run out of her medication.
Ah, okay. That's simple, but critical.
Exactly. And she was highly educated, understood her condition, which helped. It highlights how vital consistent treatment is.
Right. And the third case, the meditator hearing voices.
Case 3, the staunch meditator. Despite her deep practice and the spiritual feel of her experiences, also diagnosed with schizophrenia.
Really? Even with testing the voices and everything?
Yes. Actually, her mindfulness might have helped her describe her symptoms so clearly, leading to a very early diagnosis just 5 days after the voices started.
It's interesting.
She went on low-dose meds, and the voices faded in about 3-4 weeks. Her rational mind questioning the voices, trying that bank account test, that fits too, and those weird physical sensations she felt. Also, typical symptoms in schizophrenia.
So, the common thread. All three ended up being diagnosed with schizophrenia.
Yeah.
That's striking.
It really is. It shows how common it can be and underscores, again, early diagnosis and sticking with treatment.
And remembering Dr. Phang's father, low blood sugar, it just shows the range of medical causes.
Yeah, exactly. Which leads to another point. It's maybe not surprising that temples or religious centers often become places people turn to first when experiencing psychosis.
Because the symptoms can seem spiritual.
Precisely. Dr. Phang did research at Sento Temple, and monks there confirmed many devotees came to them with hallucinations or delusions of control. These places feel safe, or maybe the symptoms align with spiritual frameworks people know.
There's a risk there too, right? If they see the wrong kind of healer.
A huge risk. That's the really concerning part. Dr. Phang's research found over half the psychosis patients admitted to HKL, the main hospital, had seen traditional healers first.
Over half. Wow. And what are the dangers?
They can be severe, not just wasted money. We're talking actual physical abuse, like those jaw stick burns, or beatings bad enough to land someone in the hospital.
That's awful.
There are cases of people being chained up, given magic potions that are really just psychiatric drugs, but with no proper dose or monitoring. And shockingly, even cases of sexual exploitation, especially for women with certain symptoms.
Oh my God, that's horrifying.
It really is. It's a stark warning. Trying a quick spiritual fix can sometimes lead to much worse harm, physically and psychologically. You have to be so careful.
Definitely. So caution is key. What about common misunderstandings? Things people often get wrong.
Yeah, good question. Dr. Phang points out a few. Things like hysteria or speaking in tongues. While they look unusual, they are not psychosis. They're usually cultural or psychological things. Psychiatrists can tell the difference.
Okay, so different categories.
Right. Also, seeing spirits. This doesn't automatically mean psychosis. Some people genuinely seem to have this ability. If they're functioning well, otherwise holding jobs, managing life, it's not psychosis.
So the key is impairment.
Exactly. Psychosis interferes with daily function. Can't work, can't maintain relationships, can't care for yourself because of these experiences. That's the red flag needing medical attention.
Got it. And what about meditation? People worry it can cause problems.
That's a really important one, especially for this audience. Dr. Phang is clear. Meditation does not cause mental illness. Full stop.
Okay, that's reassuring.
However, he says it can sometimes trigger a relapse in someone who already has a vulnerability, like a genetic predisposition to schizophrenia.
Oh.
Usually if it's done improperly, like someone stops their prescribed medication because they misunderstand precepts about drugs, or they engage in really severe fasting or extreme sleep deprivation during intensive retreats, or they have totally unrealistic expectations about reaching enlightenment quickly.
So it's the context and how it's practiced, especially if there's an underlying issue.
Exactly. And he stresses, meditation is not a treatment for active psychosis.
This really reframes things. But it brings up that tricky question. Can spirits or charms actually cause psychosis or symptoms that look like it?
Yeah, that's the big one, isn't it? And this is where Dr. Phang offers that really nuanced middle way view. He balances the medical science with spiritual beliefs.
How does he approach it?
Okay, so from a purely Western medical perspective, the textbooks say there's no evidence for spirits causing psychosis. He mentions Ajahn Brahm, citing research suggesting ghosts are usually harmless, maybe mischievous, but not causing severe mental illness.
Right.
And even in Buddhist texts, hungry ghosts usually need help. They don't typically cause severe mental breakdowns in others.
Okay, that's the medical and traditional Buddhist view. But
Dr. Phang, being a Buddhist himself, keeps an open mind. He uses that phrase, absence of evidence is not evidence of absence.
okay, so he doesn't dismiss it.
No. He points to Venerable Agasita's article on spiritual self-defense. That article does describe spirits causing things like noises, voices, even controlling movements, symptoms that sound a lot like psychosis.
So there is a spiritual perspective that acknowledges this possibility.
There is. So Dr. Phang's conclusion. It's possible but rare, maybe like 0.001% of cases, he estimates, where spirits or charms might cause these symptoms.
Possible, very rare.
Exactly, which is why his main advice is so strong: don't jump to conclusions.
That feels like a really balanced and compassionate way to look at it. Okay, so for someone actually facing this or helping someone who is, what's the practical takeaway? What should you do? You don't want to get stuck or waste money on things that don't work.
Absolutely. And Dr. Phang has a very clear, important take-home message on this. It's really actionable.
Okay, what of it?
First, again, do not jump to the conclusion that strange behavior is definitely evil spirits or black magic.
Right. Resist that first impulse.
Yes. The wise, pragmatic first step is seek medical help first. Go to a GP, a regular doctor or physician.
Why a GP first, not straight to a psychiatrist?
It's often less stigmatizing. People might be more willing. And GPs are trained to spot the signs of psychosis. They can assess for those other medical causes like low sugar or thyroid issues. If needed, they will refer you to a psychiatrist.
Okay, that makes sense.
Yeah.
Start broad, rule things out.
Exactly. Dr. Phang even mentioned a specific GP in the area known for being good with these situations, highlighting how finding the right doctor matters.
So medical help first. What else?
He also supports a holistic approach. While you're getting medical or psychiatric help, psycho-spiritual support can be valuable too. Things like prayers, blessings from qualified, respected religious teachers like chief monks.
Okay, so it's not either.
And not necessarily, but he offers a kind of litmus test.
The litmus test, how does that work?
If spiritual interventions like those 5 spiritual self-defense methods Venerable Agasita teaches,
Go to those quickly.
things like the scarecrow technique to deter spirits, chanting, hard heart, radiating loving kindness or metta, soft heart, sharing merits, open heart, or mindfulness, clear heart. If those methods, plus blessings from respected monks, do not bring any relief, then it's almost certainly a medical condition.
Ah, I see. So if the spiritual approach doesn't work...
Don't waste time and money going from healer to healer. Focus on the medical treatment.
That's very practical advice.
It is. But he also acknowledges a big challenge. Often, the person experiencing psychosis doesn't believe they're sick.
Right, the lack of insight.
Yeah, research shows something like 72% of patients disagree with their families about their condition, which is why education, like this deep dive, and real family understanding and support are just so crucial to help someone get the right medical care.
Wow. Okay, this has been incredibly insightful. Dr. Phang's perspective really sheds light on something often kept in the dark. That we've seen that, while maybe spirits are a tiny possibility, statistically, practically, psychosis is a common, treatable medical condition.
That's the key message.
And knowing where to start getting help seems absolutely critical.
Absolutely. Seek medical help first. Start with a GP. They can rule out physical causes and refer to psychiatry if needed. Yes, embrace a holistic view, include psychospiritual support if it feels right, but let the medical assessment lead. And Dr. Phang's honesty is quite profound, isn't it? When asked how to definitively tell the difference between spiritual and medical causes, he basically says, the answer, in short, is, I don't know.
Wow.
And because it is so hard to know for sure, keeping an open mind is vital. But the most pragmatic, compassionate path, always rule out the common, treatable medical stuff first. That ensures people get effective care quickly.
So for you listening, what does this all mean? If you or maybe someone you know is showing unusual behavior, remember this deep dive. Remember Dr. Phang's advice.
Yeah.
Don't jump to conclusions, however tempting they might seem. Start with medical care. Stay open-minded, yes, but understand the bigger picture of brain health. It's really a profound journey, isn't it? Understanding the mind and just how important compassionate, informed action is. Definitely something to mull over.
Absolutely. Until our next deep dive,